Well, a warm welcome to today's talk, Saturday evening, the 3rd of September. Basically, when we look at the pandemic, the coronavirus pandemic, the numbers are going down quite dramatically, so I remain fairly optimistic about that. And we'll be looking at some good news tonight as regards natural immunity. Immunity people are enjoying as a result of being exposed to the virus. But there's also some data that continues to concern me on excess deaths, which is still pretty high in a lot of countries. Now, just a bit of orientation first of all, slides. Here we see the number of cases. Now, we know these aren't accurate, but in South Korea and Japan, they actually are testing quite well. So we can see that their Omicron outbreak, their Omicron wave is going down. So that's good news for them. Patients in hospital, though, we see Japan is really quite high at the moment. Now, it looks like it's just turned the corner, but still quite high. Japan, of course, has a fairly elderly population and didn't suffer badly from previous waves, so didn't have as much opportunity to build up natural immunity as we have in other countries. Still talking about a number of patients in hospital. The UK down, Australia down quite nicely. The United States is going down, but more slowly, but still going down. That's good. Denmark and Ireland and Canada's figures remain somewhat erratic. Now, new daily confirmed deaths per million. So again, these are relative, so these are quite useful to look at. Japan's highest at the moment, then Australia, but we do see the deaths in Australia has gone down. Then the United States, South Korea, New Zealand, United Kingdom, Canada, Germany, Denmark, and Ireland being low at the moment. But cumulatively, we see that the United States, of course, has had more deaths than anyone else. Where data is collected, we're sure the deaths are higher in Russia, of course, but this is what we have good data for. The per capita deaths in Russia are higher. So United States, United Kingdom, overall high deaths rates. Germany, Ireland, Denmark, Canada. Then Australia, South Korea, New Zealand and Japan, all relatively low death rates. Now, this is excess mortality. So as probably most of you know, more people are dying than we would expect for the 5-year average. And there's various reasons for this, some of which we could go into, others of which we would have difficulty going into. But at the moment, excess deaths are high in the United Kingdom and a lot higher. Round about 20% according to our World in data, then Ireland, then Germany. Australia, data's a bit out of date for Australia, but round about the 9% mark. South Korea, Japan, New Zealand, Denmark. Now the United States on here looks low. And I'm not going to show you the graphic, but if we did look at the graphic, we would see that the United States has actually got the highest cumulative rate of excess death. So I think what is showing here is that most of the vulnerable people in the United States have sadly already left us, have already died. So that's current, but as I say, the cumulative gives a different picture. Moving on quickly to UK data, we've got some pretty good UK data at the moment. So here we have new daily cases, just over 100,000. Currently symptomatic, just under 1.5 million. But the point is, the trend is going down really quite nicely in the UK. And I would expect this to carry on going down, at least until autumn time. So big reduction in the number of cases. Now, UK official data, patients admitted 4,124 for the week, down 14% over the past 7 days. But, and this is really quite an important point, many more people are being admitted with COVID than primarily for COVID as their main diagnosis. So that's good news. So here we have that graphic here. So what we're seeing is people admitted with COVID are now the majority, about 60% here. So these are patients admitted with COVID or diagnosed with COVID as an incidental finding. Now, this week or this next week, we're going to stop testing for COVID routinely, so that number will change dramatically. But this is when we still were testing. And the patients actually admitted primarily for a COVID diagnosis, as we see, round about the 40%. So this is just indicating the high prevalence that we have in the UK at the moment, that people are admitted with, and these people are admitted for. And this is consistent with the sort of lower levels of severity of COVID that we are seeing. Now let's look at some ONS data. We see that the numbers are going down in England quite nicely, and in Scotland also. Really quite a satisfying reduction in the number of people diagnosed. And of course, with the Office for National Statistics, this is based on a survey, so we know this is accurate data, and this is extrapolated to the whole country. Weekly hospital, overall weekly hospital positive admissions, so this is admissions to hospital, as we see going down, but many of these are, well, the majority of these are with rather than for COVID, and intensive care admissions remain low. So pretty encouraging. Now, this is what's more concerning, the excess death data. Now, here we have the excess deaths. The dotted line is the 5-year average. So we see, of course, these are the deaths from COVID in blue, and of course we expected the excess deaths to be higher during the waves of the pandemic, but the point is we're still above the 5-year average. Now, the deaths in blue are COVID deaths. And these are deaths that are not attributable to COVID, not attributable to COVID. So the blue is attributable to COVID, the green is not attributable to COVID, and we see it's above the 5-year average. So this remains a concern. And it's not just the UK, as we saw, it's everywhere. And the United States has suffered worst cumulatively of anyone from these excess deaths. And we have made videos on possible causes of this in the past. Now, this is the proportion of deaths. Now, this one is influenza, and this one is COVID. So what we see is that people are actually much more. This is the likelihood of dying with COVID. Sorry, this is the likelihood of dying from COVID, as opposed to with COVID, as opposed to influenza, dying from influenza as opposed to dying with influenza. Now, what this means is that if someone with the same age and the same risk category gets COVID, they're much more likely to die from COVID than the equivalent person with influenza. So we see that COVID is still quite a lot more deadly than influenza, and that's based on that good quality Office for National Statistics data. And we've looked at that. So let's move on to just look at some of the Office for National Statistics in a little more detail. This is the prevalence. So England is 1 in 60 people. This is the week ending the 23rd of August, always a bit behind, of course, for the ONS. So, but still pretty high prevalence. We know it's going down now, though, from the COVID symptom tracker data. Wales 1 in 65, Northern Ireland 1 in 50, Scotland 1 in 55. Now, reinfections within the Omicron wave. People that had Omicron, 14.6 of them got reinfected with Omicron. So that's Omicron and Omicron wave. Within the Alpha wave, people getting reinfected with Alpha in the Alpha wave, it was 1.8%. So in the Alpha wave, people that had Alpha infection, only 1.8 of them got reinfected. And in the Delta wave, it was only 1%. So we see that there's a lot more people getting reinfected with Omicron than there was Alpha and Delta and Delta. So that kind of looks bad. But if we look at this in the context of the data we looked at the other day from Portugal, we actually do find it's not as bad as it looks. So this was the risk of contracting BA5 infection amongst people who've been exposed to previous variants. So exposure to the Wuhan variant gave a 55.7% efficacy protection, Alpha 58.8% protection, Delta 64.5% protection, again indicating very good news for natural immunity. And people that had BA1 or BA2 had a 76.8% protection against BA5 infection. But it looks like the UK efficacy is 84.4. And now I can't really guarantee that. That's just based on this 14.6% getting reinfections with Omicron. But we do see from the Portuguese data and the UK data that people that have been previously infected, regardless of the strain, regardless of the wave that they were infected in, are enjoying good degrees of natural immunity. And in the case of Omicron, that looks like it's somewhere between 76.8 from the Portuguese data and 84.4% efficacy of protection from the UK data. So I'm really quite encouraged by that. Now, a problem here is long COVID. This is another problem that's pointed out. Now, 2 million people in the UK in private households, 3.1% of the population have, and this is the key phrase here, self-reported long COVID. So this isn't based on some sort of objective diagnosis, unfortunately, but 83% of those have had symptoms for 12 weeks, 45% for 1 year and 22% for 2 years. Now this is concerning because especially people that have had it for 2 years were worried about permanent tissue damage that may not recover very quickly at least. Symptoms for long COVID: fatigue, shortness of breath, difficulty concentrating, muscle aches. So 31% of people with long COVID get muscle aches. 33% have difficulty concentrating, 37% have shortness of breath, 62% get fatigue. And from COVID symptom tracker data, we've got a lot of other symptoms that long COVID patients suffer from. I'm not going to read out the list, but we'll paste them. Weakness, tiredness, shortness of breath, muscle aches, trouble sleeping, difficulty concentrating. Having said I'm not going to read them out, I am. Headache, anxiety, worry, low mood, loss of smell, memory loss or confusion, loss of taste, cough, vertigo, dizziness, chest pain, palpitations, loss of appetite, sore throat, nausea, vomiting, abdominal pain, diarrhea and fever. So they are the symptoms that people with long COVID are complaining of. And this is a significant cause of morbidity in the population. And given that, 22% have had it for at least 2 years, then a fair chunk of the 83% that have had infection for at least or long COVID symptoms for 12 weeks, some of those are going to go on to get longer term long COVID, unfortunately. Now, we don't have data on how many people are actually being admitted with long COVID. We believe it's relatively small, but some people certainly are. So it is a problem of unknown magnitude and of unknown duration, but it is going to be a problem in some people for indefinitely into the future, I am afraid. Symptoms adversely affecting day-to-day activity in 73% of those with self-recorded long COVID. So there we are. The picture in the world is mixed. Cases are going down. I'm quite optimistic about this winter because we haven't still got an obvious successor for the BA5 variant of Omicron, and we see that the levels of immunity from the previous waves of Omicron are actually quite high. So this makes me optimistic that we're developing more and more natural immunity. I'm not saying herd immunity because we're not reaching herd immunity, because herd immunity would mean it would go away, whereas we're going to enter a period of endemicity for some time, unfortunately. The excess deaths, though, remain a major concern because they're high. In the UK, it's about 1,000 excess deaths per week at the moment. And in the United States, proportionally, it's been slightly higher than that. So many more people are dying than we would expect compared to the 5-year averages. Now, let's just conclude with a couple of interesting points. The first one is China. So they're having rolling lockdowns in China. They don't have a lot of official cases. Why they haven't got tens of thousands or tens of millions more cases, and this is a bit of a mystery, because COVID is like you can't keep the tide at bay, as King Canute showed in his humility that he couldn't keep the tide at bay, doing that to demonstrate his humility and mortality. Mere human beings can't reverse the tide. And I'm afraid it's the same with Omicron. Yet the Chinese are still trying. Really quite bizarre. Sporadic cases around China in the south, and Guangdong and Shenzhen, northern city, Dalian, Chengdu, various places, Hubei province, so all around China. Varying levels of restriction, closure of venues and restaurants, delayed schools reopening. These are not going to stop. These are not going to stop Omicron. It's quite inevitable that everyone in China is going to be exposed, the same as everyone in our countries. Well, I say everyone, there might be a few people that haven't been exposed, but basically most of us have been exposed, 99.9%, way more than that, have been exposed repeatedly. And how the Chinese think they can avoid that is really is like trying to stop the tide. But foreign visitors at the moment have to spend more than a week in a quarantine hotel, often with poor sanitary conditions, so there have been complaints. Masking, testing, close contacts. Some people, asked to move to quarantine facilities or obliged to. And even the World Health Organization, which, and of course we've seen the head of the World Health Organization visit China on many times. They seem to be on quite good terms, shall we say. The World Health Organization is saying it's unsustainable. It's just very strange. And the Anbound Research Centre in China has actually dared to question the government policy, which is encouraging. Preventing the risk of economic store should be the priority task, according to this think tank. Just baffling. A nation of brilliant people like China, and I think the problem is in China they just don't want to or can't be seen to be losing face. It's not a concept that I'm familiar with because I lose face all the time. But it's just the culture. It really is potentially crippling for a billion people. But there you go. Now, the last thing no one wants to know, but I'm going to tell you anyway. Moderna is suing Pfizer. This is the press release. Moderna sues Pfizer and BioNTech for infringing patents central to Moderna's innovative mRNA technology platform. Okay, so Moderna Chief Legal Officer, we believe that Pfizer and BioNTech unlawfully copied Moderna's inventions, and they have continued to use them without permission. Pfizer, of course, are completely bemused, but we are surprised by the litigation, given that Pfizer-BioNTech 19 vaccine was based on BioNTech's proprietary mRNA technology and developed by both BioNTech and Pfizer. And we will not be following that story with interest unless, and it's a big unless, and it's possible that interesting things related to our health and well-being come out during legal proceedings. So there we go. I'm quite optimistic really about this. It's the excess deaths that are really worrying at the moment. The pandemic numbers are going to go down unless a particularly powerful variant with more immune escape than BA5 comes along. I'm fairly optimistic about this winter, actually. Yes, there'll be cases, but I'm hopeful it's not going to cause lots of hospitalisations and deaths as previous waves have, because we're burning up more natural immunity. Influenza might be another story, but that's the topic for another video, so we'll leave it there for today, and thank you for watching.